Good. Good afternoon, everybody. Thanks for joining us again. As you know, every Wednesday we host a live event to try to answer some questions. So as we get started this afternoon, if you have questions, start commenting in the live stream below, and we'll take those questions and respond to as many as we can. A couple things. One, we kind of reoriented for today, not to make it more casual, but we wanted to get to a few items and kind of talk a little bit about the ongoing response to the pandemic. And of course, there's a lot of information, I think, for us to discuss. So let's first start with some basics. Since we don't have our screen behind us, we went old school with sort of printed data. So since we started the testing regimen here in Dutchess County, we've tested 11,583 individuals, and many of you have questioned whether or not those are completed tests. Yes, they are. These are 11,583 completed tests in Dutchess at several testing sites. You know, the test site at Dutchess Stadium is operated in part in partnership between the county and New Vance. There is, of course, Mid-Hudson Regional Hospital operating a test site at their campus. Pulse MD is also operating a test site in the town of Poughkeepsie. This may come up, but Mayor Rob Ralston and I are working on a potential test site at a Rite Aid location in the city of Poughkeepsie. And so that we hope is something we'll be able to announce, although I guess we partly did, is operational within the next several days. That testing is going to become increasingly more important as we focus on the restarting of Dutchess, the reopening of America in one way or another. And as we'll talk today a little bit about it, happy to answer some questions about it, but as we see sort of a regional and incremental return or restart, if you will, testing is going to become even more important. It's going to be necessary for us to be able to identify very, very rapidly individuals who test positive, to quarantine those individuals and ensure that we're tracing them. So in fact, Dutchess County's Department of Behavioral and Community Health, which 60 days ago began identifying individuals who test positive and then contact tracing and then quarantining, we've established and will be expanding the teams necessary to be on top of identified positive cases as we move toward a more aggressive testing structure in the state. Yesterday, Governor Cuomo met with President Trump. It was announced at the conclusion of that meeting that the federal government is making available, I think, in the neighborhood of 40,000 new test kits in New York State. The governor and president agreed that a more aggressive and widespread access to testing is necessary in New York if we're going to monitor the transmission of the disease and then also begin this reopening. So let's talk a little bit about some of the test data. You can find all of this at dutchessny.gov. This all exists at dutchessny.gov. Our data dashboard is open and available for you to review. Within that data dashboard, of course, are municipal information. First, nearly 2,300 confirmed cases, 2,294 confirmed cases. Now, within that number, this includes 365 people who have recovered and sadly 32 deaths. So we're looking at approximately 1,900 active cases, which is, by the way, we're starting to see these numbers stabilize. You can see and sort of monitor the tracking on our website at dutchessny.gov. We are seeing stabilization. So the growth rate is slowing in Dutchess, number of positive cases. We've tested about 4%, nearly 4% of the county's population, 3.5% of the county's population. That is a very high rate of testing. So for the size of our county, we've tested a substantial number. That will expand as access to testing expands. We actually have a very low infection rate compared to other regions. We're at about 2.5 individuals out of 10 who end up testing positive. Same protocol, same regimen as it relates to testing no matter where you go in the state, but about 2.5 out of 10 test positive, which is a relatively low rate of infection. Additionally, and I think it's important as you look at the town by town numbers, there, as you visit our website, there's no area of alarm for us. We're seeing cases that generally reflect the population percentages within the county. There's a few areas that are a little bit high as compared to the population. That's likely more to do with a facility like a state prison or a facility within it. So for clarity, if you look at the town-by-town numbers, those cases are relatively equivalent to the population percentages within Dutchess County. So those are the basic numbers as we stand today. You can find that at dutchessny.gov. If you have a question, please add it to the live stream. Just as a reminder, next Wednesday we'll again come to you live. That will be tied together with a telephone town hall. Every other Wednesday we host a telephone town hall countywide. We've had about 9,000 or 10,000 people on those calls. And then every Wednesday we come to you live through Facebook and try to answer some questions. So the county continues our response effort, and I want to talk a little bit about that as well. First, by reminding you that we continue to operate a hotline. The Dutchess County COVID-19 hotline is 845-486-3555, 845-486-3555. That number is staffed by both volunteers and county staff. And we expect, as we transition from sort of this containment and response to restart and reopen, this hotline will remain in effect. And our goal is to ensure that we evolve the call center to meet the expectations you have. So as we move forward with restarting and reopening, and that's likely not upon us immediately, but it will happen soon, the call center will be prepared to answer and to direct questions that will be not as focused on pandemic response, but really becomes more focused on reopening and managing the response to COVID-19 moving forward. So that number is, again, 845-486-3555, 845-486-3555. You can call that. If you have a particular need, food, transportation, Dutchess Responds continues to provide that assistance. We want you to know that that we have volunteers that are working all across Dutchess, delivering hundreds of meals, and I should say at this point thousands of meals, and food product to food pantries. In partnership with the community foundations of the Hudson Valley, we have generated nearly $500,000 worth of donations. Those dollars are being granted to agencies throughout Dutchess. Yesterday we announced a round of funds in the neighborhood of $32,000. That $32,000 has been granted to agencies who are buying and delivering food products. It might be a pantry, maybe providing some unemployment assistance, legal services to those who need it, some assistance to those who might be dealing with housing concerns. So a number of agencies will continue to do that. That will continue to award funds in partnership with the community foundations of the Hudson Valley. We're very, very grateful to them and our partnership with them. Additionally, if you want to volunteer, we still have need for volunteers. You can do that at Dutchess Responds, and that's, of course, at dutchessny.gov. We're grateful to the county legislature led by Chairman Greg Pulver, Carolyn Morris, Lee Wager, and the staff at the Dutchess County Legislature are in fact organized and assigning volunteer staff. So as there's a need, they're assigning them, and some legislators are out shopping for groceries for residents. Others, volunteers are delivering food and prescription drugs, and you should reach out to us if that is the kind of help that you need. And of course, if you are at home and you do have the financial resources, donating to Dutchess Responds. You can find it at dutchessresponds.com. You can donate directly at the community foundations of the Hudson Valley. Those dollars will go directly out to the community. We're grateful to our friends at Silo Ridge. Residents of Silo Ridge in the town of Amenia are responsible for about half of what we've raised so far, and we're very, very grateful for that. And that effort led in part by the town supervisor, Victoria Perotti, and others in the town of Amenia. So we're very, very grateful for that support. But if you have the means, we encourage you to donate. We'll make sure those dollars get right onto the ground, and we're trying to help those who are in need. This is going to be ongoing, so I just prepare you. Obviously, we're going to be living in sort of this restrictive environment for some time, so the need and the demand is going to be ongoing. So additionally, I want to reference just a couple additional numbers so you have them. Again, I mentioned 1,897 active cases, so those are individuals that we're monitoring. Within that number, I want you to be aware that we communicate every day with the hospitals in Dutchess County and our major healthcare providers. We, in fact, discussed yesterday, and you likely saw the governor announced that hospitals around the state can begin opening up for elective surgeries. That does not include Dutchess, and for clarification, did not include Ulster County either. And in conversations with our hospitals yesterday, they're in agreement that we're not there yet. We have 80 individuals hospitalized with COVID-19 in Dutchess. That's actually come down a little bit, but it's remained relatively stable. Between 80 and 110 individuals on any given day over the course of the last several weeks have been hospitalized with the COVID-19. So we are ready, if necessary, to open an alternative care facility, a recovery center at Dutchess Community College. That is not necessary at this time, and we're working with the hospitals on a 5-day window. So every so many days we open up for another 5-day review, and at this point, when we began, it was every 2 days. We now have no expectation to open that recovery center prior to the end of this week, so we'll evaluate that. We're grateful to the team led by Neil Wythian, our Commissioner of the Department of Behavioral and Community Health, and Kathy Tetmeyer, the Deputy Commissioner, who is responsible almost entirely for making that decision with the healthcare providers. I also want to mention, I know there's concern regarding assisted living and nursing facilities in the county. These are licensed and certified by the state of New York. There is that relationship between them and New York State. However, in Dutchess County, we assembled teams of individuals who have direct and daily communication with our assisted living facilities. We monitor their census, total numbers of patients, total numbers that may have tested positive, and sadly, those who may have passed due to COVID-19. We are monitoring those. Our nursing homes and assisted living providers are doing a good job. However, of course, the stress is great on them, the stress is great on families, and there is a big challenge, and we are working as aggressively as we can to provide what information we can and communicate that with you and the families of loved ones in those facilities. But every day we have a team of people who communicate with and interact with those facilities to keep updated and to provide what response we can. We've been providing product to them as well, and we thought actually we'd talk a little bit about that for you today. So just as a reference, the Dutchess County Department of Emergency Response has been in the personal protection equipment buying and distributing business for about 60 days now. We're very grateful to Commissioner Dana Smith, the Deputy Commissioner Ken Roman, Emergency Manager Bill Beal, and the staff at Emergency Response, from the dispatchers to our coordinators. So we're grateful for those who function in volunteer capacity as well, working with first responders. There is little question that America was not prepared for the manufacturing and the distribution of personal protection equipment. The supplies that should have been in storage and locations weren't. That's public and private. The ability to transport this product was not as strong as it needed to be, and this has been an ongoing battle. And of course, we're buying product from outside of America, as you know. In fact, many producers in China. So we have, the federal government's been making available product, the state has been making available product, and we've been buying. In fact, we're sending a request to the county legislature. They'll meet on the first week of May. We're asking them to appropriate additional dollars to make some purchases. Just so you know, to date, Dutchess County's Department of Emergency Response has distributed 152,000 surgical masks, 41,000 N95 respiratory masks, if you will, N95 masks, 5,000 face shields, and I'll show you a couple of these. These were made in partnership with Ulster County, or SUNY Ulster, SUNY New Paltz, and our friends in Ulster County. Dutchess County made a 5,000 piece purchase of these. These happen to be with Dutchess Responds on them. And of course, you're likely not aware of these, but this is part done through 3D printing. And of course, folks can wear that and cover their faces. So these are the face shields, 5,007 of these distributed. Additionally, Governor Cuomo, in partnership with, thank you, Governor Cuomo in partnership with the federal government and Ford, the Ford Motor Company, has made these available. We received a batch of these, and these are also distributed, these masks, these face shields, important. We're giving them and using them in county government, I just wanted you to be aware of that. So 5,000 face shields, 12,909 gowns. I will tell you, gowns, the medical and hospital gowns are like the body armor for first responders and healthcare providers. Those gowns are in short supply. Interestingly enough, when the demand was for masks and face coverings, there was a shortage then. Companies moved to create and build these or manufacture these, and now that there's a shortage in gowns, they're trying to keep up there as well. We've distributed 863-gallon jugs of hand sanitizer, 5,177 small units of hand sanitizer, so the smaller hand sanitizer you're familiar with, and these are distributed to facilities all across Dutchess. We're working, for instance, with direct care staff. I want to give a shout out to the direct care staff who are working with those with intellectual and developmental disabilities, those working with our seniors, and of course even Dutchess County's own staff are out there providing direct aid and assistance to seniors and those with disabilities. We've delivered 5,177 of these, and they're being used all across Dutchess County. These germicide wipes, these hand sanitizer wipes, 833 containers, 833 of them, 43,000 medical gloves distributed, and 166 cases of water. So Wendy asked a question. I want to get to her question. When is Dutchess County going to open up? Well, let me offer, if that question is when is the county going to open, that's different than when is county government going to open. So I do want to say that county government is functioning and we are open, and you can visit dutchessny.gov. All of our departments have essential staff that are working from the office or working from home. Most of our, of course, all of our core functions are operating, so if you need assistance, visit dutchessny.gov. You can always call the hotline and we can direct you to the right agency, but again, if you visit dutchessny.gov, you'll see the contact information for departments. If the question is when is Dutchess County going to open, that's going to be based on data. So yesterday, Governor Cuomo announced sort of a change in philosophy, and again, he may have been incrementally moving in this direction or just felt it was necessary to move in this direction. Either way, it's immaterial to me. He announced this concept that as a state, just as America will be reopening, restarting regionally, that the state of New York should reopen and restart regionally as well. So using these large economic development regions, the governor has asked and tasked individuals to identify data points and to make certain decisions regionally. Two things I want to say. Number one, the decisions need to be data driven. So we've tested, as I said, almost 4% of our population. We're going to have to expand that. If we're going to be open for business, we need to be able to identify those who test positive very quickly and then contain, quarantine, and then make sure that there isn't a transmission of the disease. And the only way to do that is through access to testing. So that comes as step one. Within that data, you need to be able, and by the way, the White House has included this in their Reopening America plan or Opening America Again plan. You need to be able to show a consistent stabilization and the decline in cases. I would offer to you that Dutchess County, Ulster County, and to some extent Orange, although not as much so, is flattening. We're plateauing. And if you think that New York City, and this was discussed by the governor last week, New York City sort of plateaued last week, that's about right. We are plateauing at about 3 to 7 days after New York City. As we start to see the decline, we will be able to then move toward reopening incrementally. So number one needs to be data driven. Number two, we are different. Dutchess, Ulster, Orange, significantly different in data and in demographics than, let's say, Westchester, Rockland, south of us. So even though we agree a regional incremental opening makes sense, we don't think necessarily that the data would suggest that Dutchess and Ulster, and to some degree Orange, should be lumped in with the same potential restrictions that would exist in Westchester South because of the high numbers. And again, there's a lot of variables, demographic variables that ought to be considered. So we're going to fight for that. We're going to advocate for that. I shouldn't say fight. We're going to advocate for that. We absolutely believe that we ought to be considered based on our data, our numbers, and our demographics. And we believe that that'll be entertained by the governor's office. So Ulster, Dutchess, and Orange, we meet regularly. We discuss regularly some collaborative issues. In fact, the 3 county executives will be having another conversation this week on Friday, talking a little bit about some of the economic development tools that we have available. We'll be discussing some of the steps we want to take collaboratively. So I do believe that you're going to see an incremental reopening. I think it's going to happen, again, regionally. I agree that makes sense. I do believe that Dutchess, Ulster, and Orange need to be considered outside of simply the Westchester South model. And I suspect that that will likely begin on around May 1st. You'll see some modest incremental change, and then over the course of the month of May into June, you'll see this incremental restoration to some degree. The new normal will look different than what we looked like prior to March of this year. So that was Wendy's question. Nicholas asks, why is it taking so long to get test results back from the stadium? I will tell you, my stepfather got a test in Dutchess County a week ago. He's still waiting on his test results as well. Offer to you that he seems to be okay, I should say that. It really is dependent on which lab the tests go to. So even the stadium location, the test results go to different labs. There has been a delay with one of the labs. One of the labs is overwhelmed statewide and has had a hard time keeping up. And you could get your test results back in 48 hours or as long as 14 days. We don't find that acceptable, but this is the reality we're dealing with at the moment. I would offer to you, if you're symptomatic and you've been tested and you feel like you have symptoms, you should remain in place until you get those test results to prove or disprove whether or not you've tested positive. So I hope that answers that question. Amy and many others are asking about school closures. That's a good question. Governor Cuomo today said he's not yet prepared to decide that schools might be closed till the end of the year. This is what I think. I think that it is unlikely that schools in the Hudson Valley would return to traditional classroom settings this school year. I think that that's a decision that the state's going to make with us, and we're going to obviously work with the state to inform them. It does not seem logical that you would bring students back in a traditional setting. I do think that there will be some consideration for things like, and a group setting wouldn't happen, but graduating seniors, certain perhaps presentations or projects that may need to be wrapped up. But our school teachers have done an enormously difficult task of transitioning from teaching in the classroom to teaching online. My 4 kids all have different, although Theo is only 18 months old, he doesn't have any classroom setting. But from our 3-year-old who's getting online interaction with his daycare provider, who is not open, to Jack, our nearly 11-year-old who is at Red Hook Elementary School, 5th grade in elementary school. They're doing online using Teams and other online Google Classroom. To my daughter Abigail, who's been doing online learning through her special education classroom at Red Hook High School. And again, I want to give a shout out to those providers, teachers, librarians, library directors, those direct staff like speech therapists and physical therapists who are all doing this online. But again, as they've transitioned to this, it would not be logical to have them immediately transition back. So again, we'll make the decision with the state, we'll inform the state, but what I'd offer to you is I do not believe it is logical that you would return to a traditional classroom setting this school year. I don't mean to make news. I don't have any reason to know that that's the governor's final decision, but I can offer to you that would be logical, I think. So that's where we are there. So a number of people ask about the numbers on the Dutchess County dashboard. When you visit dutchessny.gov, and you visit the information dashboard, the impact dashboard, you'll note that our numbers are different than the state numbers. Here's the answer. On any given day, generally at 11 a.m., Governor Cuomo announces statewide numbers. That includes hospitalization, that includes confirmed and active cases, and deaths. Over the course of the next 24 hours, county governments across the state of New York, mandated and charged and responsible for validating and verifying those numbers. For instance, there are times where a Dutchess County resident may get a test in Rockland County. And in getting that test in Rockland County, sometimes they could be misclassified as a Rockland resident. So that needs to be validated. So over the course of 24 hours, we validate addresses, we confirm cases. We also identify with the hospitals their hospitalization numbers that have to be drilled down and clarified. In some cases, sadly, the death numbers are significantly different, and we need to validate and verify that. So over the course of 24 hours, we validate, we verify, we correct, and our numbers are then posted. So when you see our numbers, they are 24 hours after New York State's. They are certainly not as timely, but they are likely more accurate. And that isn't a discredit of the state, that is our job. Our job is over the course of those 24 hours to clarify, correct, and refine those numbers, and that's what you see when you go online, and that's important, I think, for you to know. Allison and others are asking when the DMV will be open. That is, first, the DMV is a New York State entity, functioned and governed and operated by Dutchess County government under County Clerk Brad Kendall's leadership. We're not sure yet. I would suspect that certain aspects of DMV function would be among the first things that would reactivate or reopen or restart in the month of May. Remember, no legal action on suspensions. That's correct. So you're safe as it relates to sort of the procedural work that you need to do. Yeah, just hold on to your information. Make sure you're ready to go when we're able to reopen. I'll warn you that I suspect that there will be delays because there'll be a massive push to get certain transactions done, but we're not sure yet when DMVs will open, but I suspect in the first part of May, some of those functions may very well begin. They may be sort of online and over the phone, but nevertheless, some of those functions may likely begin, and county government is preparing for the assumption that between beginning of May and end of May, there will be a restoration of certain activities of government, and we're preparing for that. We have a restoration, in essence, a reconstitution committee that's working on that. Andrew was asking about churches being allowed to reopen. I suspect that will be slow and incremental. If you remember, church functions were among the last things to be regulated on the way into this crisis. So I suspect that they're going to be among the last things out because of large groups. But I can say that the White House plan to reopen America in phases, and the governor has spoken to this as a legitimate sort of framework, that there are certain functions that if you can achieve the data points, and we've managed the testing, there's certain things like group settings, if you can meet the social distancing, you can manage the social gathering and try to minimize those numbers, that those sort of functions would activate again. As you know, Dutchess County with Ulster and Orange acted very quickly. We closed schools 2 weeks before the state did. We instituted no social gathering requirement, I think of 12 people or greater, 10 people or greater. There are going to be those kinds of restrictions for the foreseeable future, but some incremental return. We're grateful to the churches and the synagogues and houses of worship that have transitioned to online services. Very, very helpful, and obviously for those of us who want to continue to exercise our faith in that sort of church setting, or that kind of congregate setting, being able to do that online has been great. Patricia lives in Poughkeepsie, but she will drive anywhere in Dutchess to deliver groceries. First, Patricia's not alone. We have hundreds of people who are willing to drive anywhere. So if you want to volunteer, visit dutchessny.gov. Dutchess Responds, and so it's dutchessny.gov/Dutchess Responds. You can sign up to volunteer. Two kinds of volunteers we're looking for. Those with medical background, sign up for the MRC, Medical Reserve Corps. Always happy to have more. We've had hundreds participate. And then general volunteer service, where we can put you to work. I'll prepare you some of the functions that, for instance, the Office for the Aging engages in through the summer months are not likely to happen in group settings. So we may have need for volunteers throughout the entire summer to help us deliver food and meals. And to check in on seniors and those who are vulnerable, and we'll want to make sure that happens. So dutchessny.gov/Dutchess Responds. So I want to talk a little bit about some of these products that we've gotten. I want to, as Patricia mentioned, I'll let you catch up. As Patricia mentioned, a lot of folks have come forward to volunteer. We've had many people make homemade face coverings. As you know, we're asking, and the state is directing, that you wear or have access to a face covering, in particular if you can't engage in social distancing. So you're headed out to the walkway, and I'll tell you, we had a conversation with State Parks yesterday, the day before. We need folks to engage in social distancing on the walkway. Just as a reference, these are the kinds of facilities that if you can't engage in them in social distancing, they're going to have to close. So we want to make sure the walkway doesn't close and our rail trails don't have to close. We need you to engage in social distancing. And so what that means is keep it small. Walk in groups that only include your immediate family. If you want to meet another family out there, it's best not to, but to try to engage in that social distancing. But if you're out, you should have a mask with you. These non-medical grade masks, great volunteers all across Dutchess made these available. We're very, very grateful to them. This is the kind of thing, non-medical grade, that you could wear to cover. I want to acknowledge the state in partnership with Hanes, makes undershirts and other under products, has made these available, and these are being distributed throughout Dutchess County, again from Hanes. And of course, I just want to mention these medical grade. This is an N95. You know, we've encouraged folks. N95s should be reserved for frontline staff and medical related staff, in part because they should be fitted appropriately. The nose guard, make sure that you're able to control what comes in and comes out under the mask. So again, N95s, we've, as I mentioned, distributed over 41,000 of those across Dutchess. And the traditional surgical mask, 152,000 of these distributed by the Department of Emergency Response, Dutchess County, to providers and folks all across Dutchess. These may have been donated to us by Vassar College, but we're grateful to those who have come forward. Vassar College, a number of automotive dealerships and others have donated these. We're very, very grateful. And as I said, we've been buying them. In fact, we're going to be asking the county legislature for $1.5 million, nearly all of which will allow us to buy these PPE so that we can continue to distribute in the weeks and months ahead. So if you have a question, please add it to the comment line below, so in the comment line of the live stream, and we'll be happy to take a question throughout. We're here for an hour. Barbara is asking about the availability of antibody testing, so I'll give you two things. I feel like that's my standard response. The two answers are this. First, antibody testing is both underway, although not widespread. And second, there is going to be an expansion of access to antibody testing. Within those answers, the first wave of these tests, we'll offer to you, we're not satisfied with the efficacy. So some of the antibody testing that we've seen to date, and the governor has spoken to this, and without me getting into an enormous amount of detail, I will tell you, that it's the test kit, it's the swab, it's the activating agent that's used. All of this has to all work, and the efficacy of that antibody test, the initial ones, some of the tests that we saw distributed, we just were not comfortable with the efficacy. Negatives being positive, positives being negative. That is being fixed, and you're seeing providers. The governor of the state of New York is expanding access, and you're seeing major providers, the big companies that you're aware of, now making them available. And Dutchess County's healthcare providers will have access to them. Individual organizations like Paramount, Premier Medical, and of course the big hospitals, Nuvance and Westchester Medical, there'll be an expansion of access. So when I talk about the need to be able to scale up widespread testing, part of that is the very quick, rapid test that would identify positive, negative, and some of that is, not some of that, a lot of that is also the antibody testing, right, to identify if you, one, have already contracted it and have recovered from it. So that is underway. You can access it in small numbers, and that is going to continue to expand. But again, for us, from a government perspective, and if you're interested in sort of monitoring and reopening, we need that rapid testing to occur so we can monitor positive cases. If you have a question, add it to the comment line in the live stream below. Question about what types of businesses might open first. You know, it's sort of like, again, you want to, whoever was the first one in will be the last one out as far as the restrictions, right? Large gatherings, large businesses that, business entities that that may have large gatherings may not be the first to open. You can envision things like landscaping, small business or individual construction, painting, or home repairs, those kind of jobs that would allow for social distancing, personal protection equipment, and limited interaction with larger groups. So you can see those kinds of businesses. Again, I do think that you'll see elective surgeries open or become accessible. We hope within the next we think 2 weeks, you'll start to see some of that happen as well. I do think you can see some of the retail businesses, although not, but again, that because of the large numbers that could convene, I wouldn't expect that up front and early. So the kinds of things that where you could clearly limit the total numbers, you could absolutely engage in social distancing, and you could make use of the personal protection equipment. Those are the kinds of businesses you can envision sort of opening first. And again, regional. So we expect and would ask that where there's higher density and some variables that should be considered, more restrictions, longer period of time for an incremental return. Where we'd argue in Dutchess County's case, perhaps our numbers are a little bit better, not as good as upstate, and we've said this, by the way, we're probably a week or two ahead of where, or maybe even longer, where Westchester South would be, but we're likely a week or two behind where perhaps other areas upstate are. So because they haven't had the density and the high numbers of cases. So again, incremental regional return, where again the first few businesses and the business activities that would restart are more able to reduce reduce the gathering size, sizes of numbers of people coming into a business, engage in the social distancing, and then of course use PPE in order to protect and minimize the transition. So I want to remind you, while we have you, if you have any ongoing questions or concerns with COVID-19, you can contact us at 845-486-3555, 845-486-3555. Also want to reference, this is a stressful time for a lot of people, and of course the burden, excuse me while I get my card, the burden on individuals is great. We continue to operate the county's mental health services. We have about the most comprehensive mental health services of any county in New York, and our helpline remains open 24/7, and that's at 845-485-9700. So if you need help dealing with addiction, or you may have a particular mental wellness concern, 845-485-9700, and you can call or text that number all day, any day. So June's asking, when will contact tracing begin in Dutchess County? First of all, contact tracing has occurred from day one. So the very first positive case that occurred in Dutchess nearly 60 days ago, we have been conducting the contact tracing. So I know this is lingo and sort of language that's becoming new to us. Every positive case includes contact tracing. We have teams of people at the Department of Behavioral Health and Behavioral and Community Health that monitor. As we expand testing access and do this rapid testing in order to monitor moving forward, we're going to have more people. We're going to need an army of people to do contact tracing. And I'll advise you now, some of the traditional functions of county government are not going to return in the way they were prior to March of this year, because the departments and individuals within those departments will be refocused on some of the contact tracing, some of the restoration efforts, work to restart the economy. So that's been ongoing, and it is ongoing. Felicia really wanted me to know how much she likes my Marist mug. This, I will tell you, is the Dutchess Community College is always upset that I'm drinking out of a Marist mug, but my heart is with all of them. But this mug is big, and I need the coffee. There was a question regarding colleges, and I think it was Felicia asking when colleges may reopen. First, those decisions are up to the individual college presidents. I can tell you again, I mean, we know that they'll remain closed this semester, that there'll be some less traditional graduation and commencement functions that'll occur. I think it's likely and logical that you will see class functions to some degree occur in the fall semester, but I would not dismiss the concept that more coursework and activities, in particular those where there might be concern regarding group settings or even vulnerable populations, that coursework, I think you'll see an expansion of online and distance learning. And Many have talked about this. I agree. In fact, in 2018, I said, a government all across the country was sort of functioning in a 1980s model, and we needed to modernize. What we've learned, and I'll tell you, in Dutchess County, we've done a lot in the last 8 years, but we've accelerated it, obviously, these last 60 days to make use of and lean on technology to make decisions and to conduct work. But government and colleges and schools are going to have to do more to lean on long-distance learning. And I think, if anything, we found, one, the deficiencies within the system, meaning some of the technology was just not there to be activated very quickly. And secondly, the benefit of it. Whether you're in a school classroom or not, being able to directly communicate with teachers and classmates online and through obviously secure settings is proven really productive in some ways. And to use that technology, I think, is going to be critical if we're going to reopen, when we reopen and restart, in particular, school settings. I'll tell you that for county government, we lean on Microsoft. Very grateful to the company, Microsoft, and the use of Teams, where we do our meetings and interaction that way. And we have just found, going into this, we were using it more, and now in the midst of this pandemic response, that use of that technology has enabled us to communicate. And we are, by the way, communicate daily and regularly. Jennifer is asking, or at least mentioned, the governor says schools and businesses need to open together, but if schools don't reopen, what does that mean for the businesses? I think part of what he's saying is that, one, if you reopen businesses, you need some place where students to go, so schools would have to be reopened. But again, keep in mind that assumes, one, a traditional school year. That ends in the middle of June. And two, that there are no other alternatives for families with students. So yes, that has to go hand in hand to some degree. But again, there'll be opportunities, meaning certain businesses can reopen at certain stages, where and essential versus non-essential. I hate that term. I think every job is essential. I think every person is essential. But whether or not you needed to report to work to do that particular task may be curtailed to some degree, and therefore allowing perhaps for in cases where it works. Not every family can do this. Where one family member could stay home with children, etc. So there will have to be some balance of that. Are police patrols? Are there police patrolling to break up gatherings? Who enforces those restrictions? Was Karen's question. The short answer is the governor's order and my executive order includes the ability for police agencies, building and code enforcement, and the Department of Health to enforce these regulations. And to the degree that they can be, they are. Now listen, we want to be sensitive to how you enforce these things. So law enforcement, asks, encourages, building inspectors explain that if you don't engage in the social distancing, if your staff is not using the personal protection equipment, you could stand to be fined. The Department of Health advises if we have a food permit or a permit that we issue to you, that could be revoked. Nearly every case is resolved relatively quickly through that kind of interaction. But yes, law enforcement has and can issue violations. In Dutchess County, so New York State created this sort of task force statewide. Every county has a grouping of people who are responsible for evaluating violations of those rules. In Dutchess, that is the Deputy Commissioner for Department of Emergency Response, Ken Roman. It is the Undersheriff of Dutchess County, Kirk Imperati, and its Assistant County Executive for Economic Development, Ron Hicks. All three of them take those cases. So if there's a violation or complaint issued to the state of New York, it comes back to one of those three individuals who then review it and then make some determination as to how best to enforce. I would offer to you, by the way, if you are a business and you believe, one, that you should have right to open, you can always ask for an opinion based on the governor's orders. If you'd like to be considered for a waiver, you can submit a waiver and a request for that. And that's through the New York State Empire State Development Corporation, and you can apply for a waiver. Several businesses have gotten waivers because they've been able to manage social distancing. By the way, a grouping of gun clubs and hunting clubs in principally Eastern Dutchess came together. They put together practices that met the state expectation, and they've been given a waiver. Other businesses can do the same. Scott's asking about how we are at hospitals and is capacity stressed. I want to reference again 1,897 active cases countywide, 80 hospitalizations. So the short answer is, are our hospitals stressed? is I mean, other than obviously the stress and the emotional toll on managing those cases, from a numbers perspective, they are not. And we've been able to monitor that every day. We monitor with them their total number of cases. So hospitalizations versus those in an ICU versus those on a ventilator. We know those numbers. They are relatively stable. To our credit and benefit, they have been between 80 and 110 total people at any given time, and that has been relatively stable the entire duration. As of this moment, actually at the lower end of that, at 80 hospitalizations. So not stressed in that regard, but if you have a chance to say thank you to someone in the healthcare community, please do that. If you're at the grocery store or you're at Dunkin' Donuts and you want to buy a cup of coffee for somebody who's headed off, whether it's a nursing home, a hospital, perhaps it's a direct care staff who's providing assistance to those with disabilities, or it could be the public health staff. If you have the resources to do it, that might be the time. And even if it's just driving by the hospital, honking your horn, I know they appreciate that. KT asks, can't find masks in Poughkeepsie and Wappingers. Where can she find them? So first, keep in mind they are in short supply, so masks are in a short supply. If you're not a first responder in public health, you're not providing sort of healthcare related service, I'd encourage you to visit this website. Of course, this Facebook page. You're already there. Take a look at our do-it-yourself video. You can make your own mask. Just as a reference, this was obviously this is through Hanes, and this was given to us through distribution through the state of New York and the governor's office. But you can, if you have the capacity, you can take an old T-shirt. You can actually cut it up and sew it back together in a way that looks like this. You can take a handkerchief or a bandana. Although my wife said to me, it's kind of funny. We're saying to people, if you have a handkerchief or bandana lying around, because so many people have handkerchiefs and bandanas lying around. But if you have one, there's an easy way to make it, or a piece of cloth that you can use to make it. We were on the call last week. An older woman used a pillowcase. Again, we can give you that instructions. It's on this Facebook page, or you go to duchessny.gov. We'll show you how to do it. The goal is to make use of these products if you can, to make sure that the medical grade equipment gets to those in response and responding, and then those that are not medical grade, if you could use them for your own personal care. It's also a good time to remind you that today's Earth Day, and this is a great day to remind you not only to be sensitive in all cases, right, to environmental concerns. I'm very grateful to the folks here in Dutchess. Cornell Cooperative Extension put together a program all day long, in fact, talking about some of the steps we can take to be more environmentally sensitive, and it's important we do that. Well, one of the easiest things you can do to be sensitive to the environment and protect the planet is not litter. And littering is anything that should not be thrown out your window being thrown out your window. So what I offer to you is, whether it's personal protection equipment or anything else, let's not do it. Get it to a garbage can, get it to recycling, and we'll take care of it from there. But when it comes to these pieces of equipment and materials, please don't throw them out the window. Please don't throw them on the sidewalk. And by the way, we know someone watching did. We know that it's happening all across the community. We want to encourage you not to do that. First and foremost, if it's medical grade, it should be disposed, and you've come into contact with somebody who may have contracted COVID-19, you want to dispose of it appropriately, which is really, by the way, to remove it, take it off, put it in its own trash bag, its own bag, tie it up, and then dispose of it as you would trash, but so that it's not laying out somewhere where someone can touch it. If you've not come into contact with someone, taking off those plastic gloves or latex gloves and throwing them on the ground is just not acceptable. The other is, I want to tell you that putting on latex gloves, touching things at the grocery store, and then wearing those gloves when you go home to unpack and to pick up your children, to give them a hug or to touch your face, provides you no protection at all. So remember, those gloves are used to help you protect from getting germs on your hands and then touching your face and transmitting a disease. We're good? Experiencing a technical difficulty, but we're back, I think. The question I'm sorry, it was actually a good question that needs an answer. First and foremost, nursing home facilities do have individuals who have tested positive to COVID-19 already within them. We monitor them daily, so our team works with them daily. They have a set of protocols. Those protocols are meant to isolate individuals, but also to provide care. Remembering that assisted living facilities are, by their very nature, able and staffed by individuals who are there to provide this kind of necessary care. We're good still, technically? No, we're off again. Still experiencing technical difficulties? Okay. So I will offer to you that no matter which of these technologies you use, Facebook or otherwise, they're overwhelmed by folks communicating, obviously. So that's number one. Number two, the state of New York did enter into a relationship with three facilities in Dutchess County, one of them associated with Northern Dutchess Hospital, for the potential placement of individuals with COVID-19. I can't say that, I don't have a number this second, but I do know that a handful of individuals who were not necessarily residents of one of those facilities were placed in one of those facilities. There should be two of them in Dutchess County. And what that means is that those facilities, through a relationship through the state, and these facilities are all regulated by the New York State Department of Health, entered into some contractual arrangement that basically said that they had the capacity to isolate and provide care to an individual with COVID-19. As far as we are aware, a small number of individuals have been placed in two of those facilities. Perhaps as of the second, there might be all three, but that's been very, very limited. Because mostly, one, we haven't seen the escalation of cases, which means facilities have been able to manage, and two, facilities in Dutchess County are relatively at capacity and shouldn't have additional individuals there. But we monitor that daily. We work with them daily. However, they're not regulated by Dutchess County government in any way. They're regulated by the New York State Department of Health. So we'll work with them. We continue to work with them. We identify. And I want to say this. I can imagine and know. I know firsthand what it's like not to have access to a loved one who's dealing with a healthcare or health-related issue. I know the tragedy of that, as you likely know. And of course, just the challenge of not being able to interact with a loved one who's at a facility, at a home, at an assisted living, and I can only imagine the kind of heartache that goes that is experienced. And we're there with you. We'll continue to monitor and we'll continue to work with them. I do want to mention a number of folks have reminded us that this is National Volunteer Week. I want to reference the folks from the Medical Reserve Corps. The Medical Reserve Corps is a grouping of volunteers with some interest and background in providing medical or healthcare related support. Again, not everyone has a medical background, but if you have that training background, etc., you could volunteer through the Medical Reserve Corps. We've had a huge increase in the number of individuals who volunteered. This is actually a photograph of some of the training that went into preparing to open the Recovery Center. The Medical Reserve Corps, group of dedicated volunteers led by Joe Ryan, a Dutchess County staff member and a New York Mets fan, who again have been providing great service throughout the county. So we want to recognize those from the Medical Reserve Corps and thank everyone in volunteer service. We've always had wonderful volunteers come forward in county government. This has really stressed the need for volunteers. And so whether you're a volunteer in emergency response or a volunteer in some other capacity, we thank you for your service here in Dutchess. We're very, very grateful. If you have a question, continue to add your comments. We're going to do this for a little while longer. And happy to take any additional questions that you may have. Just write them in that comment section. Again, nearly 11,600 tests undertaken in Dutchess County. Those are completed tests. A number of people have asked, are they completed? Yes, those are, we know the positive versus negative. 2,294 confirmed positive cases with 1,850 active cases. And as I said, 365 individuals identified as recovered since we began testing, and sadly 32 deaths. So I do want to remind folks, as the federal and state governments and we locally talk about restarting, in fact we kind of call it Restarting Dutchess. We have two groups of people who are working on reconstituting government activities. Again, it'll look different, feel different, and how we activate government will be different now than before March of this year. And restarting Dutchess, its economy, its community, its openness. As we start talking about that, there clearly is a desire to kind of move that as quickly as possible. I'm all for it. Let's do this as quickly as is responsible. And so we do need people to continue to hunker down just a little bit longer. We are not out of the woods yet. We can see the sunlight and the daybreak, but we are not there yet. And what that means for us is that we need you to continue to stay home as you can. Traveling doesn't make sense. Heading off to Philadelphia or some other place right now is not the time to do it. We need you to hunker down as best you can. Stay home. Engage in social distancing. So if you're out in public, again, we've said this to folks before, you get to the grocery store, you get to the Dollar General or the pharmacy. If you can't find a spot in the parking lot where there's an empty spot to your right and an empty spot to your left, then maybe that's not the time to go to the grocery store. When you get to that store, if you can't engage in social distancing, and going down that one-way aisle, there's enough people there, maybe too many people there, it may not be the time to do that. If you're out, it's beautiful. It's not yet warm, but it's beautiful out. When you get to that trail or to that park space, again, travel small, so only those of you in that home should be out at a trail or taking part in at a park. If you're launching the boat, which is now again, those are deemed essential. Boat launches and marinas can be open again, and even at the golf course, we need you to be considerate of the fact that you should be doing it in groups of only those who live in your household. And if you go out shopping, shop solo. If you can afford to do it and can do it, please. Leaving the kids home with a responsible adult, not heading out as a family to the grocery store. It just makes sense right now. It'll help us continue to slow the spread. And for our sake, if we are focused on restarting the community, and we are, we need to be able to show that we can control the transmission and not lose lives. And so being able to engage in that social distancing, going the little extra step to make sure that you're not transmitting the disease is very, very important. I was asked about summer camps, lakes and pools, and when will they be open. First, there is no group order that all of these things need to be closed for the summer. So number one, the Department of Health here in Dutchess County, when we permit summer camps, when we give permits to use pools and lakes, public pools and lakes for swimming, we are not issuing those permits today. If you're watching and you have a pool that's a public pool, or a lake or a camp program, you should still submit your permit request. When you submit your permit request, we would ask you to be considerate of and talk a little bit about how you would engage in protecting the public from transmitting a disease like coronavirus. So social distancing and some of the hygiene and protection steps that you would take. We are going to consider those on a case-by-case basis every week. And what I would offer to you is right now we're not issuing those permits. As we approach summertime, we'll start to consider that within the construct of the federal and state government. What are the limitations and whether or not we can protect the public? If a particular activity can be opened and you can engage in the protections necessary, if you're basically a daycare provider as an alternative, so folks can go back to work, we're going to consider those things on a case-by-case basis. Again, we're not doing it now. And we'll do it within the construct. The state of New York will set the parameters. We will then function within them, but we're going to consider those. We had a bit of a delay, so let's go a little bit longer. It's 4 o'clock. I'm happy to stay on with you just a little bit longer. If you have a question, please ask it in the live stream. Just add a comment below. I'm happy to answer those questions. And again, while we're not issuing permits yet, we do want you, however, to still apply, and we'll consider them. There was a question earlier about bungalows. Those are sort of group communities that close down for the winter and reopen in the summer. We are not permitting those as of yet either. We have asked that residents who occupy bungalows, meaning a second home, we're asking you to stay put until the end of April. We'll reevaluate with you at the end of April. If you have a landscaping need, that is still deemed essential under the governor's order. Single person providing maintenance is appropriate. Lawns can be mowed. You can maintain. You just shouldn't be in the business of beautifying. We'll figure out how to interpret that. But again, if you need the property maintained for safety reasons, again, if there's an actual emergency or safety or hazard concern, you can have that done by a single individual. We just would ask that you not take residence of that location, and that we'll reevaluate with you at the end of April. I would expect that will stand until the month of May, but nevertheless, we want you to do that. Self-employed and out of work, can we collect unemployment? The short answer is you can collect unemployment. The longer answer is the system is still not great. And I've been very respectful of the fact that government is overwhelmed, but we are now 6 weeks into this. The unemployment system is simply overwhelmed and not responding as effectively as is necessary. We think that the state should eliminate the follow-up phone call, allow people to do most, if not all of this filing online, and then more aggressively respond. We understand the demand, we get it, we're overwhelmed as well, but we have a responsibility to get back to you. Unemployment administered by the state of New York, you should still apply online. You do still qualify. You would qualify from the date that you were no longer able to work. So if you were employed by someone else and you were furloughed, severed, terminated, let go, the unemployment insurance goes back to that date. If you're in the case of being self-employed, it would go back to the date that you were no longer able to provide that service under the governor's order. And as you likely know, the state did add some dollars to unemployment, but the system is overwhelmed. It is broke and it needs to be fixed. Probably a good point now to tell you that yesterday the United States Senate did come to an agreement with both the Republican and Democrat conferences agreed to a CARES Act, a COVID-19 Act 3.5. It includes additional funding for the Paycheck Protection Program and SBA loans. It includes funding for hospitals. It includes some guarantee for county governments like us if we spend money on ramping up testing. Inadequate for, we're not yet there for county governments. We need more help, and we can talk about that if you have a question regarding it financially. But then again, the 3.5 bill includes aid and assistance to continue to fund the Paycheck Protection Program and the SBA loan. Also, programs that are overwhelmed and not prepared for the magnitude of this pandemic and the economic devastation that it has caused. And so we're going to lean on folks to continue to improve the system, make it easier. If you have a question regarding any of this, you can reach out to our hotline. Our hotline is at 845-486-3555, 845-486-3555. We'll happily give you some information, and as we start to transition toward restarting, you'll see that the call center will be also evolving to meet your particular concerns or needs. If you have a question, write it down in that comment section. Let's do about 5 more minutes, and then we'll wrap up. Do you think we can make plans for a graduation party? Well, I wouldn't just yet. I mean, perhaps a small group that's your family. If this is a college graduation, no. If it's high school graduation, I would guess that by the end of June into July, perhaps not at-risk populations, high-risk populations shouldn't be in group settings, and we'll encourage that not to happen. I would start figuring out how to celebrate your graduation on Zoom or online in some way. I apologize for having to say that. I just think that as you look at the numbers in particular, because while we want to be considered a bit separate from the epicenter, right, Westchester, South, there's still that ability to easily transmit the disease. And whether it's internal, meaning within Dutchess County transmitting the disease, or somebody traveling out of the county and coming back in, it really, all of this is going to be dependent on what the federal government allows. Can you and I get on a plane today and fly to Florida? I guess you could. It's discouraged. We don't want you to do it, but if, for instance, the federal government opens up that kind of travel, well, then we would want to be certain to protect from folks transmitting the disease locally. So again, group settings likely to be curtailed and limited going into the summer months. I would think that perhaps small groupings in July, the end of June, would be possible. I would probably a good time to also say this. I don't think it's likely that you will see large Memorial Day celebrations. I know a number of the American Legion halls and VFWs have already made the determination that any large Memorial Day activity wouldn't make sense. I don't think that you'll be seeing parades this year, although we'll come up with ways to celebrate and recognize those lives lost in service to this country. But that's the last week of May, so just as an indication, I would think that those kinds of group large group settings, just not going to occur in the month of May. But congratulations to whoever asked that question. I hope that you've been keeping up with your online classes and that you graduate. And I can tell you, if you haven't seen it, you should take a look at the Dutchess tourism video that was put together. Purely meant to encourage us and be inspiring. It's not meant to overlook the hardship and the challenge that people are facing. But the tagline is "We will fly again." So to that graduate, we will fly again. This too will be a chapter of our history, hopefully that we will learn from and grow from and get stronger from. Some lessons learned, no question. We will fly again as that video encourages us. So take a look at it. Also, a good time. If you visit dutchessny.gov/COVID history, what is it, coronavirus history? But if you visit dutchessny.gov, you can actually take part in our historic survey. It's a good time. We're asking residents, business owners, others. You can be as raw as you wish in your submission. This is a survey to kind of understand your view of this historic event, the impact it's had on you. And again, you can be as raw as you like. Whatever is your emotion, it is valid, it is credible, it is real. If you want to talk about the concerns regarding restrictions on individual rights, write that, because it's important to have that view and that opinion voiced. If you want to talk about the challenge of having a business closed and perhaps the concern regarding unemployment, you should do that. If you want to talk about the great experiences you've had with your family that frankly maybe we haven't had an opportunity to experience in a long time, talk about that too. It's at dutchessny.gov/COVID history. We're the only county in the state conducting this. We think it's important. I know that it'll be helpful to members of the county legislature, myself, supervisors and mayors in making decisions in the coming weeks. But it will also be very, very helpful in recording and looking back, historically speaking, to what we achieved, what we confronted, and the challenges that folks faced. Maybe one or two more. If we have any other questions or comments, we'll take them. We're going a little late only because we've gone through pretty quickly, and I know wanted to give you as much time as possible. Again, if you have questions after this call, dutchessny.gov. dutchessny.gov. You'll see our data dashboard, find out about cases and impact. You can visit Dutchess Responds to learn about accessing food. If you need help with transportation, please visit dutchessny.gov, Dutchess Responds. And if you have any question at all, you can call our hotline at 845-486-3555, 845-486-3555. So if you have any other questions, we'll take them, one or two more. Will New York pause go on? So the governor's reference, they call it New York on pause or New York pause, New York on pause. Again, the answer to that question is we're going to see a regional and incremental reopening of New York State. We are not there yet, but we are closing in on that. You saw some of it this week with some recreation points being opened again. I think you're going to see over the course of the next several weeks, next several days, again, some modest incremental reopening of certain things, but not wide scale. And over the course of the next 6 to 8 weeks, you will see an incremental regional approach. So New York pause will start to incrementally change. And we'll begin restarting Dutchess, which is sort of our mantra, restarting the county, restarting the community. And you'll see that incremental regional approach over the course of the next several weeks. The governor's announcement is that there are 10 regions in the state of New York. Each of those regions should be considered independently. For those who've been following along, we've asked that Dutchess, at least Dutchess and Ulster and Orange, be considered by our data points, because that regional council or that economic region includes Westchester, Rockland. We think that they have demographic issues and demographic data and case data that's different and would allow us to be considered somewhat separately. So with that, I think we've exhausted your time. But again, we're going to be live next Wednesday for a telephone town hall. Is that in the evening? That's at 5:30, probably 5:30 to 7. 5:30 to 7 next Wednesday will be a live telephone town hall and Facebook Live event. We want you to participate in that. Every Wednesday on the county's Facebook page, We host these 1 hour and apparently 15-minute long updates and then every other Wednesday is a Facebook Live and telephone town hall. So let me stop by saying if you have a question, visit us at duchessny.gov or call us at 845-486-3555. In the meantime, be well, stay safe, and be kind to each other.